Hello, my name is John Rodriguez and I'm an instructor with the Miami-Dade Fire Academy. In this video, we're going to go over the 2 ways to open an airway and basic airway management. So if you're dealing with an MOI, mechanism of injury, that's a trauma call. So we're going to be holding C-spine. The way to open that airway up is with the jaw thrust maneuver. You're going to go to the patient, put your hands along the jaw and slightly thrust upwards, trying to maintain that C-spine position. Next, we're going to talk about the head tilt chin lift. We use the head tilt chin lift when it's a NOI, which is a nature of illness call, and it's a medical call. With the head tilt chin lift, you're simply putting your hand on the patient's head, your other hand under the patient's chin, and your head tilting and chin lifting until you open up that airway. Now we're going to talk about administering the ventilations. Here I have a BVM, or a bag valve mask. Here you have the actual mask that you're putting on the patient. The apex or the pointy part goes towards the patient's nose. The way that you carry this is you use the C-E clamp. The C and the E. The C goes around the mask and the E goes around the jaw. And you're going to open up that airway all the way. Now before you perform a ventilation, let's say we're using the head tilt chin lift method, you want to visualize inside that airway looking for any blood, vomit, or if there's anything that the patient could be choking on. When I apply my CE method, I'm going to go ahead and give 1 rescue breath. You're going to be squeezing the bag only until the chest rises. If you have resistance, you're going to readjust the airway and you're going to visualize inside the airway again to see if there's any sort of obstruction. After that, for an adult, we're going to be breathing 1 time every 5 seconds. And if it's a pediatric, 1 time every 3 seconds. We're only squeezing the bag until you have chest rise. 2, 3, 4. 2, 3, 4. Those are the 2 ways to open the airway and basic airway management on a patient. Thank you.